Hi, doctor.
Hi, can you hear me okay?
Yeah, I'm back.
Okay.
Can you hear me? Good. Okay.
So I emailed you a recent article on gut health and
Okay.
how they were trialing a probiotic.
Okay.
It's still an ongoing study, but it looks like even that alone helps considerably for long COVID by fixing the bacterial biome. Were you able to look at those two files I sent you?
I'm, let's see.
I attached them originally to the chat.
Gotcha. Let me, I,
If not, I can resend them.
yeah, or you're welcome to email them to me,
I can do
and,
that too.
and I can also before I post any uh video, just confirm that I didn't miss anything, you know, uh, that I have
No,
the info correct. I think
sure.
that's
I'll
only fair because you're participating in helping to educate the community and myself. So uh, go back to Zoom. All right, so here they are.
yeah, I'll also send them through to the email so you have them.
Gotcha. I have them here now. They're still in the meeting chat, so I'm gonna go ahead and.
I sent them through email as well.
Okay, perfect. Just quickly. I'll save. Okay, I saved both of those. And
Yes, I have, and you can look at them at your leisure. There's a lot of information in there. I'd like to ask you a question. How
sure.
can I help you, or how can I help I guess the Long COVID Association, LCA?
Um, we are,
Okay, that name, LCA,
yeah, I'll see.
also,
It was
also
just
happens,
abbreviated, but technically we're a long COVID association.
right, but we also have a Los Colinas Association, also called LCA, which which could be somewhat troublesome. You
Yeah.
know, it's a homeowners association.
Oh, oh my goodness. So I usually don't go by uh, LCA, but I had the hardest time. I don't know if you've had any issues, but like trying to get anything with the word COVID as an organization posted uh, on the different platforms has been quite challenging. Even though it's the name of the nonprofit organization, just even getting listed with some social media has been challenging. So I've had to like abbreviate the name, or I mean, things have changed. But when I originally started, it was just so extremely conservative and automated that nothing was getting approved until I just said the area we cover, that we're mandated to cover, and abbreviation and what we do. That was that was the only thing I could put up, but you know, I I thought it was pretty interesting why certain platforms accepted your organization name, but other ones made it very difficult. And it's just been like very hard for scientists to communicate with each other. So that's been one of my mission, to improve connecting uh, scientists with each other, doctors with the scientific community, patients with both of them, everybody talking, because to me, that's fundamentally how I believe the process works, that you move forward in your knowledge and in solving any problem. And one of the first professors that I had the benefit to hear lectures from was Dr. J.W. Costerton. This will be a short story.
Okay.
Who was from Calgary, Canada. He's known as the father of biofilm, and
Wow.
he connected so many different disciplines. He had physicists and engineers helping him design these very tiny spheres that could go and navigate inside biofilm to show the waterways, uh, that, how water was being moved through biofilm. I mean, such amazing things. He was like educating the community back in the 80s on biofilm associated infection, how to it's a race for surface between the tissue and the microbiome. Whoever gets there first, you know, has the footing. And that's how they came up with better and better, or artificial joints, things like that. They did prophylactic antibiotics built into them. And a key thing he taught was how treating a biofilm associated infection versus a bacterial infection that is like free floating is completely different. How you approach treating those types of infections, where the bacteria is like in your bloodstream versus in a biofilm, just growing and growing and growing. The way you approach addressing it is quite different, because inside that biofilm, there's a community that's working in concert to make it very hard for your antibiotics to get through, or any of your
Right.
mitigation strategies. So it was really interesting how he used every discipline and connected those disciplines together to advance the knowledge so quickly. And so I always admired that. Um, I I still from time to time find some of his lectures out on YouTube, and I'm so excited to hear that they're still out there. And anyway, so that was one of the first areas of microbiology that I found very interesting, and um, did some of my first work on. Like, so anyway,
Yeah, that sounds very interesting.
yeah,
This is really the only way we're going to solve this thing, I think, is working together, bringing different disciplines in, and sharing information. And
yes,
this is not going to be solved in isolation, I don't think.
right.
Um, but yeah,
And patients, a lot of them that are in their support groups that are talking amongst each other are like sharing what they learn. Like, did this work for you? Did that work for you? you know, what did you learn from that appointment? And they're even trying to come up with ways to do better when they get to their doctor appointments. Like one patient who has had severe MCAS and lung related long COVID issues. She went so far as to put all her medical records together that would be specifically related to that specialist appointment, give them in advance, and even included a pen. So if the doctor had to take any notes on those, she wanted to make it as easy as possible, that the doctor had everything they needed ahead of the appointment.
right,
Um, they're sharing tips like this, like I'm telling them, focus on your top three things, and make sure you mention those first. Don't wait till after you've told all your troubles and then expect to have anything addressed, and to make sure you have it written down, because a lot of times when you're in pain or you're not feeling well, you forget something. It's part of that brain fog. It's
Yeah,
part of,
it's often that I'm about to leave the room and we get a by the way, I have this, and this. I'm like, what were you talking about for the last 20 minutes?
right, right. And it's hard for you because you want to fix it, but the next person has been waiting that you also have to take care of.
Right.
So it's not like you don't want to listen. I think I, you guys must feel very torn. How do
Well,
you,
there is some time pressure, obviously, and you want to give everybody an equal amount of time to talk and listen, and so we can listen, but we do have a finite amount of time. If you spend 3 hours with one person, there'll be another 3 or 4 people who will not be taken
no,
care of.
right. So
So yeah, it is a conundrum.
what would be like some tips folks could prepare for an appointment with you, and then you can go on to like some of the you were going to talk about different medication protocol treatments that can help, that sort of thing. But since we're on the topic of preparing for an appointment to come see anesthesiology, long COVID specialists, how would they prepare specifically for that? Um, let's say it's the first appointment, and then for a second appointment, when they come in for treatment, do they have to wear special clothing? All these certain tips to know in advance so we can
Sure.
help people organize and prepare.
We certainly can do the block on the same appointment at the first visit, or if they're local, it's probably better to talk about everything and then do it a different day.
Okay.
If they're coming from out of town, that's fine. But if you want to know what information would be most helpful to a physician like myself, is tell me what symptoms you currently have from the long COVID. Tell me how long you've had these symptoms. Tell me which ones are problematic for you. I mean, you may have symptoms, but they may not be causing you too much problems. Like I've had some patients who are more concerned about the brain fog than the parosmia, and I've had patients who tell me the reverse. What have you tried? I want to know both home remedies, internet remedies, medical remedies. What have you tried so far? What has worked for you? What has not?
These are
You,
awesome tips. Keep
do you
going.
have you tried that cell ganglion block before? Have you tried TENS? Do you have a TENS unit? Because almost all my patients, I recommend do the TENS either before or right immediately after the cell ganglion block. Bring it with you. Bring the TENS unit with you. I'll show you how to do it the right way, and there won't be any questions or anything.
Oh my
Even though
gosh.
I do have a video.
That's a bonus. That's a bonus. Has anyone ever wanted to video how to do it? Like, when I've had some physical therapy, I was able to have my physical therapist record how I'm supposed to do the specific, exercises, because a lot of times we forget the minute we leave the medical facility, we oftentimes forget all the steps, how many we're supposed to do.
I
Uh,
haven't had anybody ask, but I do
okay,
have a video on
okay,
YouTube on the channel that
okay,
shows basically step by step how to do it. But
okay,
if anybody wants to record it or wants to record me setting it up, that's fine too. Because
okay,
nobody really asked.
okay. And would you share that link to the video, or share the video so I can upload it
Sure,
and add it to this,
I'll look for the. I sent you the main. I sent you the main
the main website?
the main website. I will find the video and I will send it
Yeah.
while you ask me
Okay.
questions.
Okay. Um, you were mentioning the like a lot of people uh with anesthesia pain management, uh some of them even before uh long COVID have chronic pain issues. Uh how do you incorporate any precision medicine like pharmacogenetics testing to see what they can metabolize properly to like kind of mitigate that, let's try this, let's try that, especially when people are sick. You know, I see the medical community slowly starting to adapt that. um I'm just curious, is that part of your philosophy, or do you
Yes,
use
we
that?
do have that available to look at how various medications, including pain medications, are metabolized. However, it is an expensive test without insurance, and some insurance policies won't cover it. So it really depends on the circumstances. It takes about a month or so to get results.
Okay.
But it's a
But
genetic test looking
gotcha.
at the enzymatic process in the liver mostly.
Do you see any uh like, for example, uh we're seeing a lot more patients with uh finding out they have Ehlers-Danlos syndrome. Have you come across more cases of that?
Yes.
Uh,
So
okay, so I'm not hallucinating that.
no,
That's for real. Okay.
no. Okay. So you're basically asking what's correlated with long COVID,
Yeah,
and I look at it two ways. One is what predisposes you to long COVID. You know, because you have so many people who've been infected with COVID, but only an average of 7 to 15%, 70%, depending on the source you look,
right,
develop long COVID. Why is that?
right.
Well, I think part of the reason is that some people are predisposed genetically.
Yeah,
Some people are predisposed environmentally. So there's certain conditions that either uh, damage the autonomic nervous system beforehand or continually damage the autonomic nervous system. Ehlers-Danlos happens to be one of those. And yes, we're finding it more often in
yeah,
people with long COVID. It can even present as a pseudo um, Ehlers-Danlos syndrome where people develop hyperflexibility.
yeah.
And again, it's all associated with MCAT because
And
mast cells,
POTS and
right,
dysautonomia.
right. So mast cells have an enzyme called elastase, and it's a useful enzyme, but it also has a nasty side effect when it's being released all the time, and it dissolves certain protein junctions
Yeah,
and breaks down protein, and in particular, it breaks down things like skin, tendon, ligaments, and basically the composition of blood vessels. So things are more floppy,
right.
and they're much easier to close or obstruct, and ligaments become more
Something
flexible.
like this, where this finger gets locked up and my kids are like super, like they call me Spider Mom sometimes. And I
Well, if
can,
it gets locked up, you may have a trigger finger, and that's a
yeah,
different too.
it's like really hard
Yeah.
to and it doesn't perfectly straighten out anymore. I did have to have the carpal tunnel release on both hands. And I asked the doctor, I said, did you biopsy my tissue? What? I was like, you're already in there opening it. Why didn't you send it to pathology? You know, that's how my mind is always thinking. And doctors are like,
Gotcha.
they like, Amira's coming. Oh no. Oh my gosh. She's going to ask all these questions. So I'm very appreciative of how many questions you've answered of mine. And Please
But that's
continue.
that's for a different reason.
Yeah,
Usually, trigger finger is caused by basically a stickiness of a tendon going over a pulley. So
yeah,
we have kind of a pulley system in our fingers that pulls the distal part of the finger against the pulley in here, which
yeah.
lets us do this. You can even feel it if you put your finger right below the junction. You
I
can feel
feel
that
it
little
right
pull.
in here. And
Right.
this started along with the accelerated arthritis in these thumb joints. Like I did heptathlon from age 10 till about 28. That's like 7 events, a lot of lifting and training and hours of training. And I've had my share of arthritis moments, but I didn't know I had any shoulder issues or any issues in one of my knees until after this accelerated autoimmune. It's like somebody flipped something and triggered it on me, and it's been a race to slow it down, stop it, and find everything possible to take care of it and stop it, you know. So I seem to have slowed it quite down, but we still need like a molecular cure to uh, my opinion is to get rid of the spike protein instructions that are floating around in our body that keep triggering these events. But anyway, go on. You were speaking before and I interrupted you so excitedly when you mentioned about uh the connective
I
tissue
was just going to mention,
being the pseudo Ehlers-Danlos and
well, I was going to mention basically what conditions you often see associated with an increased risk of developing long COVID. You can't necessarily do anything about it the way we are.
right,
Um, but they're mainly going to be autoimmune, but some of them um, are basically neurologic, like Ehlers-Danlos is mainly a genetic issue with a protein um, causing issues with hyperflexibility. But things like diabetes type 2, for instance, attacks your nervous system, but also
right.
attacks your autonomic nervous system. It's one of the biggest ones.
They
Um,
don't mention that too often.
they don't mention it too often, but it does put you at risk because it damages the autonomic nervous system. It damages the nervous system in general. You develop a peripheral neuropathy or the
Yeah,
autonomic neuropathy as well, which affects gastroparesis, right?
right,
In
right, right.
diabetics, it also affects issues with their heart.
That's true.
You have lupus,
Right.
you have rheumatoid arthritis, you have Crohn's disease, you have ulcerative colitis. All of these conditions are associated with autoimmunity and damaging the autonomic nervous system to some extent. You also have external factors such as infections like Lyme disease. How many people have you seen with Lyme disease who also who have had Lyme disease who are also developing long COVID?
Right.
If Lyme disease is not caught, for instance, and it becomes chronic, um, it can reactivate. So can Epstein-Barr virus.
Right.
It can reactivate in people with long COVID, but it can also predispose to long COVID. And obviously, things like dysautonomia, POTS, MPS are all, what came first, the chicken or the egg.
We also noticed some folks who have reactivation of shingles and also the chickenpox reactivation of shingles. And then a lot of folks are noticing in the community they share a common thread of autism spectrum disorder as well as ADD, ADHD. They're finding when they're talking to each other, they share a lot of the same sort of common diagnoses, or it's been something they've learned as long COVID is developed. Like, I would never suspected I had Ehlers-Danlos till I'd been talking to so many people, and I go, you know, a lot of the symptoms I'm having are very similar to that. But it seems to me that if you can keep the gut in check, you can mitigate some of what folks who are displaying the connective tissue issues, to keep it at bay. It, like, my philosophy is that our gut, again, is doing so much for us that when you disturb it, you affect everything else. So if you can heal it, like, remediate the gut microbiome and allow the gut tissue itself to heal, you can completely change your health. That's my
Right.
theory.
So, yeah, and I agree. I agree that the gut is very important in this. But with things like POTS or MCAS, one can cause the other. One can cause dysautonomia, and dysautonomia can promote those two conditions as well. So it's kind of in a loop,
Right.
and we always wonder what came first.
Right.
But a lot more people have MCAS than they realize with long COVID, even if they don't have the histamine issues or the skin or the allergic reactions that MCAS is known for.
That's interesting you bring that up because one patient finally said it was when they did a chronic urticaria
Hmm.
test that she was finally diagnosed with MCAS.
Right.
That test showed up positive. All the other tests were not conclusive. So she was telling everyone, ask your doctor to test you for this. I mean, these patients are like, no one is going to save us. We have to save ourselves. We have to advocate for ourselves. So,
Well, to be fair, a
yeah,
lot of doctors are really not up to date on all the new information coming out, and it really is a lot of information, and it's
yeah,
almost daily,
yeah,
and you have to kind of keep up with it. And unless your practice is long COVID centered, it's really difficult to keep up. So, we're talking about stellate ganglion block, and we're talking about vagus nerve stimulation,
right.
but there's obviously other treatments out there that I use and other doctors use. One is nicotine patch.
Yes,
Nicotine,
I heard about that from a doctor in France using it. Um, please tell us more about that. That
sure.
seems interesting. That
So there's been two studies so far that have shown effectiveness, including for smell and taste. And obviously, a nicotine patch is available over the counter as long as
right,
you're of age.
right,
Um, you could just walk into any supermarket or pharmacy and pick one up. And we just want the smallest dose, which is the 7 milligram. And why I prefer that over gum or vaping or something like that is because with gum, for instance, nicotine gum, you get a large bolus similar to
uh-huh,
smoking a cigarette or vaping,
right.
and you get a bump and then it drops back
Drops off.
down
Yeah,
really quickly. Whereas a patch, you get a steady state over 24 hours. And what's happening kind of under the surface is that COVID causes reduction in expression of ACE2 receptors. And that may be a body's defense mechanism, I don't know, but that is also how COVID enters
right.
the cell.
It's one of the ways, at least the first variants have been entering,
Right.
and it has
Um,
affinity. Like every virus has affinity. It has affinity for the human ACE2 receptor. And that's why we're seeing over 200 symptoms, because there's over 61 tissue types in the body, blood vessels and immune cells, where
right.
these ACE2 receptors are. So that's what I can contribute to the.
So
No, go ahead.
it is a ubiquitous receptor. It expresses on almost every tissue in the body, including the brain. And surprisingly, ACE receptor blockers, like the sartans, have
Uh-huh.
not shown to reduce risk of infection. So just blocking the receptor wasn't sufficient to reduce risk of infection.
Right.
However, what nicotine does is it increases the expression of these receptors. And these receptors are very important in day-to-day maintenance activities and
Right.
function of our body. And a lot of people have recovered just from using nicotine patches.
It's like putting a diversion, like sending the virus over to the wrong
Well, no, I don't think, I mean, yes, there is some utility in using it during an acute
or the
infection.
viral protein. Yeah, or the protein.
I'm talking about in general,
Oh,
let's say there are some remnants of the spike protein still circulating around tissue. You're basically increasing the number of receptors available for function because
gotcha.
when receptors are occupied, they don't work. I mean, you can't really bind them to what they're supposed to bind
So you're
to.
taking the circulating spike protein and giving it a place to bind that isn't going to
Well,
interfere with metabolism
there
of
you
the cell.
go.
Okay,
There you
gotcha.
go.
We're
So
gonna
it's kind
add
of a
pictures
roundabout
to all
way.
this.
Yeah, it's a roundabout way of doing it, but it does help and work. And two independent studies showed effectiveness. People worry about addiction.
Right,
Nobody in these studies developed basically to become tolerant or addicted or wanting to smoke after the patches,
right,
which is a good sign. I mean, I'm very anti-smoking,
right,
being a
right.
physician and
Yes.
everything, but uh,
Here's a legitimate
it was a little
medical
bit, yeah,
use.
it was a little hard to kind of swallow, hey,
Yeah,
I'm recommending a nicotine patch here.
right,
And of course, there's a slew of medications that are evidence-based,
right,
that have been part of the FLCCC I Recover
uh-huh,
protocol. And, there's first line, there's second line, there's third line, but things like ivermectin, yes, I'm not
right.
going to talk about it because I know there's a lot of controversy about it. Um, Basically,
Isn't it an just one, it's for folks to know, it's an immune modulating medication, correct? It
it's,
modulates the
I
immune
mean,
system,
if you look at it, what it's for, what it's approved for, it's an antiparasitic. It's used
like
in
river
animals like
blindness.
horses. It's used in animals like dogs, but it also has, it could be used in humans for that as
Right.
well.
Don't
But
they
it
use
has,
it for I'm sorry, don't they use it for like river blindness?
um, it's used for parasites in
Yeah,
general. Yes.
parasites. Okay, so
Yeah. So that's caused by parasites. Yes. It's immunomodulating, it's anti-inflammatory, reduces interleukins. So
right,
it does have some utility, and there's evidence
right,
for its use. But because it's controversial, I'm probably not going to get
right,
into it. I do prescribe it as needed
right,
for people who require it.
right,
Low dose naltrexone is really big,
right,
especially for chronic fatigue or brain fog. That's been useful.
right.
And we're talking about doses under 5 milligrams, usually in the 1.5 to 4.5 milligrams. There's nattokinase, which is a protein that breaks down. Um, it's fibrinolytic. In other words, it breaks up certain clots. I mean, clotting is another big issue
Another
on
issue that
COVID. I'm not so sure I buy into the microclot theory or not yet. It's very hard to prove. Things like melatonin. Melatonin, yes, everybody knows about it for
yeah,
sleep,
right.
but it's also anti-inflammatory, very much so.
Yes.
Um, as is black seed oil,
Yes.
that, sativa,
All of these,
uh,
there's studies to show its use.
right?
Yeah.
Magnesium, methylene
Yes.
blue, big sun, just being exposed to the sun,
Yeah.
generates
Vitamin
vitamin D.
D.
Yeah, vitamin D is actually a big thing in long COVID. You
Yes.
are going to be low.
Yes.
I find this almost universally.
Mm,
Vitamin D is going to be low in long COVID. No matter how
yeah.
much sun you get exposed to,
Right.
it's going to be low. It's increased use. Okay.
It's gonna be hard for some folks to get enough sunlight when they can barely get
I
out
hear
of bed.
you, but there's other ways to supplement vitamin
Right.
D. But that good old adage, sunshine and fresh air really
Yes.
does apply here, believe it or not.
Yes.
There's another I guess anti-inflammatory, resveratrol. We talked
Yes.
about that, and obviously probiotics, which we already talked about. So those are kind of the main ones.
How
Uh,
about some of the other enzymes that uh help and like and a NAC also and
Nattokinase,
niacin?
nattokinase is what I mentioned.
Yeah, I know, but there's also N-acetylcysteine, I believe, that helps with reducing fibrosis of the heart and lungs in
Yes,
studies.
yes, and yeah, you can combine that with guanfacine, uh, which is
Uh,
which is a medication used for ADHD. It's not a medicine
okay,
I prescribe. I didn't want to get into prescription medicines, but
right.
it is a prescription medicine and can help with brain fog and mainly brain fog,
Yeah.
possibly with fatigue. It is approved for ADHD right now, and it's non-stimulant type medicine. It's an alpha 2 agonist, which actually stimulates a part of the sympathetic nervous system in a special way, not increasing of blood pressure, things like that.
That's
Um,
awesome.
but it works in the brain. It mainly
See,
works in the brain.
gotta remind folks that they say if you've seen one case of long COVID, you've seen one case of long COVID, and everybody's treatment plan is going to be unique to
Yeah,
them. So you have to work with your doctor and you have to be monitored medically because your needs for supplements or any therapeutics or any medications are going to change over time as you heal or if your condition changes. So
well, this is why I say we offer comprehensive long COVID
yes,
treatment.
yes,
You're
not
not
just
just a
one thing.
one-trick pony, right?
Yeah,
You would combine multiple different treatment
yeah,
modalities, including prescriptions,
right,
including some of the or all of the medications on the FLCCC. I
right,
also include certain peptides and supplements
right.
such as vitamin D, such
Yes,
as iron, because iron is another one that
yes.
helps
A
to
lot
be
of people
low.
are deficient.
B complex, specifically
Yes,
B1, 6, and 12, those are
yeah,
always going to be low in long COVID. It's the
yes.
funniest thing. It's not diagnostic, but
Right.
you
But
just see
you
them
see the pattern that
consistently.
not only are the gut bacteria interfered with in such a way they're not pulling enough of the nutrition out of what you do eat, but your gut is not absorbing as well. So you've got like a two-punch hit,
Yes,
and you need to have
yes.
that. Plus, the food generally does not have as much nutrition in it as it used to 50, 60 years ago. That was another study.
You did hit the
That
nail
was,
on the head. You
yeah,
did hit the nail on the head. And yes, no matter, it's almost unheard of. You're taking in a ton of vitamin D,
right.
and you're getting plenty of sunshine, and you're still low. So what is
Yes,
happening here? It's an absorption problem.
right.
Um, It's on top of the increased utilization, you have an absorption, so it is a double whammy.
Yeah.
But
Well, I also noticed that I added niacin at one point, and some folks with MCAS they get more of a flushing reaction. So I was dividing my dose even into smaller doses throughout the day, and I noticed it started to help with regaining some of the feeling that I had lost to, through my legs to my feet to my toes, because I had like complete numbness from the ankle down.
right,
And it was
all
starting
the
to
B
help.
vitamins are responsible for neurotransmission to some
Okay.
extent. As you know, niacin is a B vitamin, it's N3 or B3, sorry, FB3.
Uh-huh.
So I just prescribed the entire B complex in a relatively higher dose you can get over the counter.
Gotcha. Okay.
Well, we're about